Good afternoon and welcome to the webinar on the IOF Global Patient Charter. My name is Masaki Fujita and I'm the Science Project Coordinator at the International Osteoporosis Foundation in Switzerland. I'm also the Capture the Fracture Program Coordinator. I'm happy to tell you that we have three excellent speakers today who will talk about the Global Patient Charter. We have Professor Cyrus Cooper, Dr. Famida Jiwa, and Larry Funnell. Our first speaker of the day will be Professor Cyrus Cooper. Professor Cooper is the president of the International Osteoporosis Foundation and is vice dean of the Faculty of Medicine at the University of Southampton and professor of rheumatology. He is also the associate editor of the journal Osteoporosis International. Before I begin, I'd like to inform you that attendees are automatically muted. If you have any questions at any point, please feel free to use your question box of the panel to type your questions in. Questions are gathered throughout the webinar, and I will voice them towards the end of the webinar. Now, Professor Cooper, please begin when you're ready.
Thank you very much, Masaki, and welcome to this International Osteoporosis Foundation webinar. As Masaki indicated, I am the president of the IOF at the present time. I'm a rheumatologist running an osteoporosis service here in the United Kingdom, and I direct one of our Medical Research Council units looking at the epidemiology, risk assessment and treatment of osteoporosis, a disorder that I've studied for over 30 years. The purpose of our webinar today is to introduce you to a global patient charter for osteoporosis. The background to this charter is that osteoporosis is a major public health problem worldwide. As you can see from this slide, on the top left, 9 million fractures occur annually throughout the world. That is a fracture every 3 seconds. 1 in 3 women and 1 in 5 men globally over the age of 50 will suffer an osteoporotic fracture in their remaining lifetimes. The incidence of hip fracture will increase by 310% in men and 240% in women between the years 1990 and 2050. This is a very steep rate of increase driven by our increasing aging population. And the other cardinal manifestation of osteoporosis to hip fracture, vertebral fracture, only 1 in 3 vertebral fractures come to clinical attention. The purpose of this global patient charter is to arrest these staggering population and individual healthcare burdens. We need to help raise the profile of this silent disease, and we need to make fracture prevention a global health priority. Patients from our national societies and our IOF scientific and corporate committees have developed this charter. The charter has 4 different components summarizing the rights of patients and families. The first is a timely and accurate diagnosis with assessment of fracture risk, assessment of the risk of falling, and relationship to the WHO threshold for osteoporosis, which is derived from a bone density scan or DXA, dual energy X-ray absorptiometry measurement. Second to diagnosis comes patient care. We believe that all our patients and their families should have access to effective intervention options, including treatment, lifestyle changes, as well as regular treatment reviews undertaken by appropriate healthcare professionals. Third, we believe the patient voice to be important, with involvement and choice in the long-term management plan and defined goals articulated clearly by healthcare professionals to their patients. And finally, support. care and support for osteoporosis are required from the society and healthcare providers, and these need to have as their principal objective the maintenance of active and independent living. This charter and these 4 groups of almost inalienable rights have been constructed as part of our initiative to reduce the burden of osteoporosis and its related fractures worldwide. Within the charter itself, we have itemized these different components, and we ask for help in driving improvements and showing support. We ask these of patients, of healthcare professionals, and of policymakers, health authorities, and national governments. You will see the support that we need articulated towards the bottom part of this slide. For you all as patients, we wish you to speak to your healthcare professionals, to identify your risk, and to take action for change in that risk. Assessment by risk factors, by DXA, and provision of pharmacological and lifestyle treatments. For healthcare professionals, we want you to protect your community's bone health through appropriate provision of services whereby patients can have these assessments and treatments. And by no means least important, although third in this listing, policymakers, health authorities, and national governments. Here, we request support for the establishment of coordinated models of care to help reduce the global human and socioeconomic burden of fragility fractures. And at the IOF, we have pioneered those models of care. For example, we have an initiative known as Capture the Fracture, which has constructed fracture liaison services. These rely upon the fact that amongst the highest risks of a future fracture is already having sustained a previous fracture. And a number of models are available whereby care following the sentinel first fracture, risk assessment and treatment are streamlined into a process linking secondary and primary care, so-called fracture liaison services. This is just one example of a coordinated model of care, which we hope that our policymakers, health authorities, and national governments will spearhead in the months and years to come. A number of dedicated resources have been incorporated within this Global Patient Charter. We have, for individuals, a component where a name, an email address, and a nation state can be entered, together with a summary of that individual's sort of problem. For societies, we have an endorsement route whereby the society can register its interest through our website, and a petition permits a lot of single signatories to be added at one go. If you go to the website and look at the description of the Global Patient Charter, and then listen to the component audiovisual aids through YouTube, you will see the routes to the downloaded fact sheet, which summarizes the information about the charter, the infographic, which provides a diagrammatic representation of our 4 main themes and the underpinning background information, and the petition form, which allows, as I said, signatories to be added multiply at a single entry point. So remember, for individuals, sign up with your name, email, and country, and for societies, endorse the Charter. And we wish to see our individual signatories rise to over 2,017 in this year, 2017. We already have 45 endorsing societies. This next slide provides a cue to the video that we've constructed. The link to this video will be shared with our parting web email tomorrow, and it permits you to see in practice the impact that osteoporosis has on patients and the global approaches to osteoporosis and to this particular initiative of the IOF, the Global Patient Charter, in a personalized and unique manner. It is a wonderful video, and I'd strongly recommend that you view it once the link is circulated in the next 24 hours. So how do we hope that you will show us your support? Sign the Global Patient Charter now. Invite your network of contacts to sign it. Include the web link and promotional banner on your social networks. Consult influential and interested parties, as well as institutions, to sign and promote it. Promote and call your associates to action at events and meetings. And this cycle, summarized in these 5 circles, will continue to amplify itself until we get well beyond that target of 1 signature for each of the years since the beginning of antiquity that we hope to obtain, 2017 in this year. So help us to get these signatures, be the advocate in your country. Remember, you join as an individual with a signature, as a society with an endorsement, and join the 46 national osteoporosis societies to date that have participated in the Charter, and increase that sample so that we cover the population of the world to try and retard the marches of this silent epidemic. Thank you very much for permitting me this introduction to the Global Patient Charter, and I really look forward to hearing the words of Famida Jiwa and our patient representative in the contributions to come. Thank you very much indeed.
Thank you very much, Professor Cooper, for your introduction and presentation. I would like to move on to our next speaker now. We have Dr. Famida Jiwa, who will present the perspectives of a patient society on the Charter. Dr. Famida Jiwa is the President and CEO of Osteoporosis Canada, a major patient society of osteoporosis. She also currently holds the position of Chair of the Patient Societies Subcommittee of the Committee of National Societies of the IOF. Dr. Jiwa, when you're ready, please.
Thank you, Masaki. And thank you, Dr. Cooper, for your wonderful presentation. I would love to speak to all of you as a patient society and to share the work that we have done in Canada with the Global Charter, in addition to the work we've done with the Canadian Patient Charter, to give you a sense of what could be done in your own countries for utilization of this charter. So I just want to make sure that you do see my title slide. Okay. Masaki, can you confirm? Great, thank you. So at Osteoporosis Canada, we have one part of our organization that is comprised of people living with osteoporosis, and it is called the Canadian Osteoporosis Patient Network, or COPN for short. And the utilization of the Charter in Canada has been done primarily through our patient network for this reason. And I will pause on this slide because it's an important slide no matter where you live in the world. And you can replace the word Canadians with all people living with osteoporosis have the right to live without osteoporotic fractures. And this really speaks to the patient voice and what the patient would like to see done in the healthcare system to address their osteoporosis. And this is really where the patient charter becomes critical. I won't spend too much time on this slide, as Dr. Cooper has done a great job of outlining the burden of the disease. These numbers are certainly global numbers. However, the proportion of these numbers are accurate within any country in the world. No matter what country you are in, 1 in 3 women and 1 in 5 men will suffer an osteoporotic fracture. And going back to my previous slide regarding the fact that nobody should sustain a fracture due to osteoporosis, and patients have the right to have appropriate care provided to them, these numbers become staggering. So I'll speak a little bit about the Canadian Osteoporosis Patient Network and how it is comprised and how we utilized the patient charter in Canada. And it is my hope that some of this information can help you in your own countries to generate momentum around this product. As I mentioned, the Canadian Osteoporosis Patient Network is the patient arm of Osteoporosis Canada. They are responsible for informing patients and supporting patients and caregivers. They are also involved in influencing public policy. Now, this point is critical when it comes to a patient charter. Oftentimes in many countries, organizations will try to do public policy or advocacy change without utilizing the patient voice. This charter is really meant to integrate the patient voice in advocacy moving forward. And I would say it is probably the most important use of this tool. In Canada, we are fortunate to have 10,000 members across Canada who are involved in our patient network. They are structured as an executive committee, and newsletters and information is sent out regularly to this group. In a future slide, I will share with you how we communicate the patient charter to our members. So the point of the patient charter is to provide a foundation for our advocacy and our education efforts. It is really the one ask of patients and caregivers dealing with patients who are living with osteoporosis. And in that vein, it addresses the 2 most important issues for patients. 1, the right to effective bone care and fracture prevention programs, and 2, the right to post-fracture care programs. And these components are included in the patient charter. So when we looked at developing the patient charter, how did we do this? So it was led by the chair of our patient network. It involved members of the patient executive group, in addition to a medical advisor. We also included members of the general public. And all of these people were volunteers. In the drafting of the charter, the writing team met by teleconference and exchanged hundreds of emails. All of the comments received from all stakeholders was reviewed by the entire team, and all comments were tracked and recorded. And when you take the IOF Global Charter to your societies, I would recommend that you get your members involved. Get them involved in endorsing the charter, get them involved in spreading the news about the charter. It is critical that patients take the ownership of this communication because it is really a document meant for people living with osteoporosis. So the charter was launched in our newsletter and on our website. We utilize charter posters to be distributed to all of our chapters across the country, and it has been used in their meetings and in their education forums. On this slide, you can see a screenshot of our patient newsletter that goes out. And down here at the bottom, you will see that we have put in the patient Bill of Rights into the document and circulated it to our members in the country. As I mentioned, it was also on our website. Unfortunately, I'm unable to share a screenshot of our website as it is undergoing updates presently, but that is certainly a way for all of the societies across the country to create awareness of the IOF Global Charter. Other ways that the Charter could be used is to be featured in meetings and in correspondence with policymakers and decision makers. And this is such an important point that I'm going to re-emphasize it. When your societies move forward to go forward for advocacy, it is important, of course, to have a healthcare provider involved, but it is more important to have a patient involved. Only a patient can speak to living with the disease. Only a patient can speak to the debilitating effects of the disease. And the next speaker on this panel will bring that to the forefront. But I urge you in your own countries to utilize this patient charter to make the patient voice known to decision makers. The poster was also displayed at public education forums. It really serves as a starting point for conversation. Many people living with osteoporosis experience the same things, but are hesitant to speak about it because they feel that they are alone. They feel that nobody can understand what they are experiencing. The patient charter brings that voice forward and can be used as a tool to initialize conversation. The charter also explains what we do when we engage in research and other initiatives, as Dr. Cooper mentioned, such as the Fracture Liaison Service. And on the screen in front of you, you see once again the IOF Global Patient Charter, which breaks down the components of diagnosis, patient care, patient voice, and support. This is a critical document to bring the patient voice forward. I cannot emphasize that enough. And we urge you all to sign up today, to have your members sign up today, to sign the charter and help us create a global movement for osteoporosis. Please communicate to the members of your societies, to the members of your partner societies, to make their members sign the charter and be an advocate in your own country. Thank you very much. It is now my pleasure to introduce the next speaker, who is a person living with osteoporosis. Larry Fennell is a member of the Canadian Osteoporosis Patient Network Executive Committee and is the past chair of the Canadian Osteoporosis Patient Network. He also sits on the Guidelines Committee of Osteoporosis Canada's Scientific Advisory Council. In 2016, he was appointed to the position of Patient Research Ambassador for the Institute of Musculoskeletal Health and Arthritis of the Canadian Institute of Health Research. Larry was diagnosed with osteoporosis in 1998 after suffering his 8th fracture. Effective treatment and lifestyle changes have kept him fracture-free for more than 17 years. Please welcome Larry.
Thank you, Famita. Just a couple of things to add. I was a longtime government bureaucrat, a job that contributed to a sedentary lifestyle, long days sitting behind a desk. I retired in 2006, and that's the same year I began volunteering with Osteoporosis Canada. So this picture of me that you should be able to see on your screen typifies what the disease means to many people who live with osteoporosis. I have a cast on one hand, a splint on the other, and the beads of sweat on my forehead give away the fact that I'm in a lot of pain, making it difficult to perform even the simplest of tasks. My apologies. Okay, this is the outline of my talk. As Fanita said, I'd already suffered 8 fractures before I was diagnosed with osteoporosis. And like those around me, I thought I was accident prone and more than a bit unlucky. For me, a slip on some wet grass or a tumble into some empty cardboard boxes meant yet another broken bone, a trip to emergency, perhaps a cast, and months of physiotherapy. It never occurred to me, nor did it occur to the various healthcare professionals who treated me in emergency rooms, X-ray and cast clinics, and doctors' offices, that the fractures were somehow connected to my bone health. The fractures received excellent care, but time and time again, the underlying cause of the broken bones went unnoticed and untreated until my wife's doctor, upon hearing my story of fractures, ordered me to get my bones checked. Well, the diagnosis that followed set me off on a long journey to answer 3 questions. Why was I breaking bones so easily? Why wasn't I diagnosed much sooner? And how could I end that cycle of recurrent fractures? The journey wasn't an easy one. I slipped into a lengthy depression. I was reluctant to accept, but at the same time resigned to the fact that men do get osteoporosis too. As many everyday activities assumed too great a risk, I became increasingly withdrawn and isolated. Household chores or family outings that required climbing or uneven footing excluded Grandpa Larry. Frustration and helplessness were ever present. A father should be able to help his son lay some new patio stones or help his granddaughter move into her first apartment. Instead, it was me anxiously waiting for one of them to come over so I could ask for help putting the Christmas lights up on the house or pruning the cherry tree. Feelings of guilt and shame made it difficult to control the urge to do something risky myself rather than ask for help. Adding to the problem was the fact that I was embarrassed by the incorrect stigma of being a man with a woman's disease. So much so that for 8 years, I hid my condition from all but my family. It seemed easier to brood and sulk by myself than to admit that I was less of a man. Learning more about the disease did little to comfort me. Prevalence among men and women, mortality rates, admissions to long-term care, loss of independence. The statistics all weighed heavy. I learned that it was not normal to break bones so easily, and that the fragility fractures I was receiving were the most obvious, but far too often missed warning of osteoporosis. And I learned that I was at high risk to receive more of those fractures. 2 more broken bones disheartened me, then helped me strengthen my resolve to get better. I sought help from the experts at an osteoporosis clinic, and together we found the treatments that worked for me. I finally stopped breaking bones, my spirits lifted, my confidence grew, and I regained a quality of life that I had not thought possible. In my quest to learn as much as I could about the disease, I quickly discovered that there was no shortage of information and treatments for osteoporosis in women, that is. But what about men? And what about me? Why had I apparently been singled out? I dug even deeper. I scoured the web. I read everything I could get my hands on. I attended education forums. I joined the local chapter of Osteoporosis Canada. Then I joined the executive committee of the Canadian Osteoporosis Patient Network. And the volunteering snowballed. Advocate, fundraiser, blogger, newsletter editor. Through it all, there was one common thread. Each new volunteer job helped me to find more of the answers that I really craved. It took years for my anger and frustration with the healthcare system to dissipate. I gradually came to understand that the question was, why us and not just why me? I wasn't the only one trying to understand how so many people could fracture over and over again when proven treatment was so readily available. My desire to learn more about the science and policy environments behind the apparent mismanagement of the disease made me more determined to take charge and to do what I could to help make improvements. Thoughts like these prompted a group of us, mostly patients just like me, to develop the Patient Bill of Rights here in Canada. That's the one that Famita just talked about. At the risk of repeating some of the things that have already been said, let me briefly explain why the Bill of Rights and the Global Patient Charter are so important to me. First, I strongly believe in the vision that they aspire to, a Canada, indeed a world, without fragility fractures. Second, they motivate me and give me the courage to speak out and become engaged in initiatives that better the lives of those affected by osteoporosis, whether it's research, advocacy, the development of clinical practice guidelines, or helping to educate others. Lastly, when I do speak out, whether it is advocating an elected official for improved access to medications, talking over the fence to a neighbor who recently fractured, or discussing my own osteoporosis with my doctor, the charter helps me explain to them why it is important they listen and take action to prevent the next fracture. So what have I done, and what can you do to support the Global Patient Charter? Well, you've heard this already a couple of times. The first step is easy. Sign it yourself. Second, use the power of social media to share the charter with your personal contacts and encourage them to read it, sign it, and in turn share it with others. Immediately after I signed, I tweeted it and I posted it on Facebook, sharing it with my friends, my family, and my colleagues. And this wasn't just people with osteoporosis, those were all of my friends and family. And I encouraged them to sign and share. Third, never pass up an opportunity to promote the charter. Print out copies and take them with you to meetings and other events where osteoporosis patients gather. Using the excellent material provided by IOF, it should be an easy sell to encourage them to sign on too. For instance, tomorrow I will be presenting the charter at the monthly meeting of a local branch of Osteoporosis Canada. So there's no doubt in my mind, by the end of the day tomorrow, I will have 40 more signatures to be able to send into the IOF. So there is strength in numbers. Together, we can make a difference. Although it has been 17 years now since my last fracture, my osteoporosis is with me every minute of every day. It guides my decisions on what to eat and drink. It makes me safely consider carefully which chores or activities I can safely do. And it has made me acutely aware of the consequences of not paying attention to my health. And of course, it motivates me to continue striving for better bone health. So I have had my last fracture and I am living well with osteoporosis. So with that, here's the final slide. Just one more reminder, sign up today. And back to you, Masaki.
Thank you, Larry Vono, for your presentation and for sharing your experience having osteoporosis. Now, we would like to move on to questions, as we have received a number of questions from the audience. What must I do after signing the charter? How can I invite other people to sign the charter?
Hi.
Well, I'm very happy to start off on that, and my colleagues can continue. So I think that if one is signing the charter and is a patient who's affected, I think the most sensible way of being able to disseminate information about it will be to pass around the link to the website that's shown on the last slide that we saw, www.iofglobalpatientcharter.org, to other colleagues, friends, family who can also sign up. In addition, if you are part of a national society, and we heard beautiful presentations from representatives of both the professional and the patient arms of the Canadian Osteoporosis Society, you can contact your local society to check whether they would be willing to give endorsement and indeed obtain a larger scale series of signatories. But it would be very simple for you to utilize that web address or to contact us at IOF in order that we can facilitate more widespread signing up or endorsement. Famida?
Thank you. Yes, I would agree wholeheartedly. The other thing I would suggest is not to underestimate the power of social media. So we have had and will continue to push the charter forward. Social media has a way of reaching people who know people. So it may reach people who are friends of people who are your friends, who may have interest in signing. So any social media platform that you have, I would recommend that you push out this link and even a brief write-up about why it is important to sign up to this charter. Also, if your societies have any newsletters or webinars of their own, I would include a call to sign up in any of your material as well. Larry, from a patient perspective, do you have anything further to add?
Well, I certainly love the use of social media, but I've found that nothing is more effective than talking about it yourself. So when you see friends, family, colleagues, strangers, if the opportunity comes up, please do talk about the charter and give them the information so they can connect. It makes such a difference to be talking one-on-one with individuals.
Thank you, Larry, Fahmi Najiwa, and Professor Cooper on answering this question. Now, if I may move on to the next question, what is our plan after 2017 signatures? Professor Cooper, perhaps you'd like to start with this question?
Oh, absolutely. I mean, I think that 2017 was our initial target of signatories. And of course, that provides us with a symmetrical number with which to engage with policymakers and health departments and governmental bodies around the world. But we see absolutely no reason why we should not proceed, to obtain as many signatories as we possibly can. The increasing momentum and the extent to which we should be able to harness resources to combat this epidemic will be multiplied with every increased 10, 20, 50, 100 signatories that we obtain. And already with the sample of over 1,000 that we have and the 46 endorsing agencies, there is a considerable willingness by policymakers to listen to what we have to say and to think about the systems of care that we offer. I will point you to a recent WHO report on global aging, in which secondary fracture prevention systems of just the sort that the IOF has pioneered were taken up as an exemplar of joining secondary to primary care. And so in just that manner, something as simple as signing up to this patient charter will actually assist really quite large-scale efforts to provide services that are much needed.
Thank you, Professor Cooper. Dr. Gio, from your experience, would you like to suggest anything?
I mean, I would support everything that Professor Cooper has said. I don't think that there is going to be a ceiling on the number of members. Definitely, if you want to make policy change, there's volume in numbers. So the charter was just launched this year. So I think there was a target for this year. But beyond that, absolutely, I see the numbers going into the tens, maybe hundreds of thousands of petitioners. And that is really the way to make a change in a health system perspective.
Thank you, Dr. Jiwa, for adding and for giving your answer to this question. Now, we have time for one or two more questions. And the next question I would like to raise is the following. If a patient society wants to collect signatures at a public awareness event, when our computers are available, how can that be done?
Oh, I could certainly take that on, Masaki.
Of course.
The petition form that I had shown in the inset in the 5th slide in my presentation is easily available, downloadable from the website. It can be printed out, and at present it's available in English or in a number of translations. That can be completed by a full list of written signatories, so that you have a list of signatures in a table, which can either be scanned or mailed back to us if it's being mailed on the web to info@iofbonehealth.org. And of course, if it's just being popped into the post, we will enter that list of signatories onto the individual listings. So basically, that petition form provides a way in which large groups of people, perhaps linked by some social interest, by family, or by organizations such as a national charity, can all be able to be submitted at once.
Thank you, Professor. And I would just also like to add that if a patient society wants to use the petition form, there are 3 things that we are really looking for: the names, the email, and the country. Now, we've had a few questions from CNSs in regards to whether we can accept signatures without email addresses. And I'd like to respond to this question by saying that we will accept signatures without email addresses, as our goal is to collect signatures. Now, I would like to move on to our final question. Now, perhaps this is a question that can be answered by a CNS. If they're endorsing, when I say if a CNS is endorsing a charter, can they co-brand, having side by side their logo, next to the IOF logo on the Global Patient Charter? And this is for their advocacy and activity use. Dr. Jiwa, perhaps you could answer this?
Yes, thank you, Masaki. Absolutely, you can. The IOF Global Patient Charter can be co-branded, which means that if you wish to put the logo of your patient society or your CNS on the charter side by side, the IOF, you certainly can, because I do think that in many cases for advocacy purposes, it will be very useful for the patient society to have the IOF name stand next to them. And I believe in order to do that logistically, you should contact Masaki or Laura at the IOF, and they can support. But absolutely, the purpose of the development of the IOF Global Patient Charter is to create a tool that can be used across any part of the globe. And in that vein, co-branding can certainly be supported.
Thank you, Dr. Jiwa. And to represent the IOF's take on this, IOF will be very happy to support this, and we will look forward to receiving information on your advocacy activities. Now, as we are running short on time, I would like to conclude the questions and answer session, and I would like to thank all our attendees for their participation in this webinar, and we all hope that it was an educational one for you. We will post recordings of this webinar along with the slides on the Capture the Fracture website. However, we will also post a video on our IOF YouTube channel. Now, upon termination of this webinar, you will be prompted to fill in a survey. Now, we would appreciate it if you could provide your input and comments, as we plan on organizing many more webinars in the future that will meet your needs. Now, last but not least, if you have any questions or comments, please do not hesitate to send them over to Laura Mistelli or to me at capturethefracture@iofbonehealth.org. On this note, I would like to conclude today's webinar, and thank you very much again. Goodbye.